Welcome to everyone. Thanks so much for taking the time to join our first relaunch of our Wellbeing Matters webinar series, initiative hosted by the Culture of Academic Medicine Initiative with the AFMC, or the Association of Faculties of Medicine of Canada. So for those who don't know about our work yet, the Culture of Academic Medicine Initiative towards Provider Safety, or CAMI TIPS, is about advancing physical, psychological, and cultural safety within faculties of medicine and leveraging the strategic pillars of the Okanagan Charter around adoption and implementation of safe, inclusive, and health promoting principles. And the Wellbeing Matters webinar series is all about how we can have conversations nationally with folks all over Canada about different kind of sticky topics that are really important when we think about advancing well-being and culture in medicine. And so for session one of our relaunch, so we have 5 of these a year, most of them virtual, but one hybrid as well, associated with ICAMS. We hope that you'll join us for our future ones. We're talking about Stronger Together, the well-being benefits of teamwork in healthcare. So firstly, I just wanted to start with a land acknowledgement. So I'm joining today from Treaty 6 territory here in Alberta. And then we have Dr. Monod and Dr. Anderson, who are joining from Ottawa, the unceded territory of the Algonquin, Anishinaabe, and Toronto, the traditional territory of many nations, including the Mississaugas of the Credit, and Treaty 13 territory, and of course, all of the other traditional lands that all of you are joining from. And I think whenever we're talking about well-being topics, and especially when it comes here to teamwork in healthcare, we need to think about the role of making sure that the health workforce is well to advance care for all folks in Canada, but certainly to bridge that significant ongoing gap that Indigenous populations experience. And this past weekend, Remembrance Day is tomorrow, but Indigenous Veterans Day was on Saturday. And so I think always times for us to reflect on our role in the health professions when we're having any conversations, certainly about well-being around the impacts to the Indigenous populations in Canada and how we continue to hold their well-being in all of our work. So just some housekeeping things for people as you're joining. These may be new sessions to you, although most of us have had to deal with Zoom nowadays. The session is being recorded, really just because post the session, we send out the recording and it lives as a kind of video for people to watch, because we have lots of people sign up in the 70s or so, but not everyone can always come. Please use the Q&A function if you're wanting to submit questions, and we'll try to get to you often at the end of our kind of initial conversation. People will be muted and cameras off during the meeting just to help things run smoothly. And then as always, we want to have engaging dialogue, but want to create a positive, accountable space for everyone. So make sure to take that into account whenever we're putting comments or things like that forward. New this year in these sections, so for audio interpretation or subtitles or any of that, we're using Worldly, kind of AI-powered solution here. So these are some ways that you can access that, either with a different device or your same. So Allison has kindly activated that in the chat. And so you can listen in a different preferred language or put on our subtitles and captioning. Okay, and then this wouldn't be possible without the work of a scientific planning committee. So here are our members. Some of them are online, I see, and we have to do our customary disclosure bit. And then this program receives funding from the Canadian Medical Association, MD Financial, and Scotiabank Initiative, who fund the Culture of Academic Medicine Initiative as a whole, for which we use resources to support this webinar series as well. So thank you to our sponsors. Okay, so that gets most of the housekeeping out of the way, and I think I kept it in decent time, so I didn't steal our amazing speakers' speaking time too much. So for those of you who haven't had a chance to meet, I'm Victor. I am a pediatrician in Edmonton at Stolly Children's Hospital, and I have the pleasure of co-chairing the Culture of Academic Medicine Initiative. at the AFMC with Dr. Connie LeBlanc, the president and CEO. And I get to be joined by two amazing speakers who I consider to be mentors and friends today. So we have Dr. Ivio Anderson, who's a full professor with the Department of Family and Community Medicine, University of Toronto. Lots of people will have seen Ivy speak about many things, including team-based care with her work with the College of Family Physicians of Canada, and other work around interprofessional education in Ontario, Canada, and around the world. So Ivy, I'll just let you say hi, and we have your disclosures up here.
Hi, thanks very much, Victor. So glad to be here. And so, hello to friends that are on. Just in terms of the affiliations that you have heard and the disclosures, just noting as you see on the slide in itself, and also specifically looking at some of the consulting fees that I have through my own work that I'm doing in consulting, as well as I'm an employed staff at the College of Family Physicians of Canada, and will be receiving an honorarium for this particular session. So, thank you.
Great. And then joining Dr. Anderson is Dr. Moineau, who actually, when this initiative started, was really a big founder of the work, and I got to co-chair with her for a while as well. So Dr. Moineau is currently Vice President of the World Federation for Medical Education. She previously was President and CEO of the AFMC, has a longstanding interest in well-being in the medical profession. So Jenny, I'll let you say hi as well.
Oui, bonjour tout le monde. Thank you, Victor, for the invitation. And it's just so wonderful to see the ongoing work being undertaken by CAMI. My only affiliations really are through the positions that I've held, and again, receiving the honorarium for today's work. Thank you so much.
Awesome. Thank you both again, and welcome, Dr. Anderson and Dr. Moineau. So our agenda, we've gone through our introductions. We're going to go through a kind of more formal presentation aspect now, which will have some slides and a little bit of dialogue. Then we'll open some opportunity for Q&A amongst all the participants. So make sure you have questions. Otherwise, you'll have to keep listening to me ask questions, and then some concluding remarks and kind of next steps from our discussion. So everyone signed up, seeing our objectives. Really, we want to talk about kind of that interprofessional teamwork environment and impact on well-being. And so, there's lots of discussion on team-based care, the idea of working in teams, and how that might have significant impact on well-being, not only of physicians, but of health professions across kind of the health workforce. So, when we're talking about that, what are we really experiencing? What are we seeing? And how can we think about this moving forward? And then, what are our strategies we are looking at around trying to improve communication, respect, collaboration within teams? Because we know that this is a huge opportunity for us in the health system around improving medical culture and things like that. So your objectives are there. Hopefully we meet them. So before I hand it over to Dr. Anderson and then Dr. Moineau to kind of go through their thoughts, remarks, I want to frame a little bit of some of our discussions with a case that many of us may have experienced something like this in the past. When team tensions might undermine care for patients and well-being. So picture, a patient in a hospital. They may be admitted on, say, an internal medicine unit. They've been there for prolonged illness, maybe pneumonia or something, for many weeks, and it's Monday morning, or I guess it's afternoon now for many of us, or even early evening. But Monday's time, we have our discharge discussions on the unit, for example. And a patient is scheduled to be discharged home. But there are concerns by the rest of the team. So the physician kind of says, hey, I think this patient's ready for discharge. They're not on oxygen anymore, or whatever it may be. And the rest of the interprofessional team, maybe nurse, occupational therapist, physiotherapist, whoever else is part of there, kind of raise concerns about whether the patient is totally ready. And so that might be because there's some concerns of whether the patient is actually able to live in the home environment. Maybe there's stairs that the patient hasn't yet been able to show they can do, or there may be some concerns about impact of prolonged hospitalization on things like delirium or cognition, whatever that may be. And then, so, because the bed flow pressure, unfortunately, this discussion isn't a positive one. Team members kind of argue, fight, and raise voices and share their concerns, but in a maybe unproductive way. At the end of the day, the attending physician says, you know what, we're discharging this patient. We need the bed. Like, this just needs to happen. And at the end of that conversation, and at the end of the day, physician and the rest of the team is just upset about the situation, right? So whereby, the intention of an inpatient team is to have multidisciplinary group work together for the benefit of the patient. In this case, we have a situation where patient gets discharged, people are uncomfortable, unhappy about it for the patient, but then also with each other as well. And so again, you can replace this with, I think, a number of situations that many of us have seen or come across in different units, across all different specialties and all different professions. And there's lots of contributing factors to that. So we can think about, priorities, right? So patient flow, discharge readiness, patient safety, some of the things that we have in our teams around hierarchies, what does psychological safety or accountable spaces really mean? Just general, like, high workload, people being exhausted. And then what are the impacts of situations like the one that I just described happening? So things like, what happens when you start to get disengaged people or people who feel some things like moral distress? What happens when people are frustrated at each other, when trust and collaboration don't come forward? And then, we talk about physician, learner, health profession, well-being, but ultimately all of that impacts patient care, right? And so again, thinking about, here we are designing a system to work together as a team, but then what happens as a result? So with that, I wonder, Dr. Anderson, when you think about the case and experiences like this, I'm sure you've had situations like this happen before. Can you talk to us a little bit about, the concepts of, how do we build psychological safety and really team collaboration, and what are your thoughts around kind of that idea of well-being in the team environment? Ivy, we can't hear you right now.
Thanks so much,
There you
Victor.
go.
Thanks so much. And I'm so glad to be here today. And thank you for the question. We've all been in those kind of situations. I know there's a number of people that have used this particular case as we look at interprofessional education and try to highlight what are those elements that create the tension and thereby create an environment where it is unsafe to speak, where it is challenging to collaborate. And I talk about that as the outcome of creating what the culture is within the workplace. And we talk about psychological safety as an outcome of how you set up how people will work so that the outcome is that they believe that they're safe to speak and their belief that they are okay to risk take. That's an outcome. But it's also what we do to make that environment. I almost call it the air that's around. How do you know that the environment that you're working in actually is safe and that the team that you're working with creates that space? And I think you get back to the self-assessment of ourselves of thinking about, do I feel safe? And am I creating safety for others? And why is that important? Because we know that psychological health and safety enhances patient safety. It improves communication. It certainly boosts professional well-being, and it supports people in the teams to innovate and to do different things, as well as to promote ongoing learning and continuous improvement. Next slide for me, if you can, Victor. And so, as we think about how you create an environment that is safe? Where does team-based care fit into that environment? And I think of team-based care or interprofessional collaboration as parts of how we want to work collectively together, and we bring that individually to each and every place where we're working and at each and every time that we're working with other people. And I use these four circles and get us to think about, are we working in a place that actually supports collaboration within the environment? So what you saw there in that particular case, were there infrastructures that enabled people to come and learn who people are beyond that situation in itself? Is there time set aside by leadership to enable us to learn the names of other healthcare professionals that are working in that space, to understand the challenges that that resident is having or the physician is having that day? And oftentimes, healthcare is so quick and fast that we don't create those infrastructures to enable collaboration to work well. And so that already is a first step to impeding the opportunity for safety and well-being. We look at the notion of leadership, and in situations like that, when there is high tension, whose role is it to kind of tell people to stop and pause? You think about the work that's been done in Toyota. It's the automobiles industry, and the work that they've done to create a culture where if there's something that goes on the plant in the plant where all of the pieces are going along, it is the role of each and every one of anybody that is there working on that day to pull the lever to say stop because there's some danger that's here. And that's distributed leadership. Recognize that, in fact, that we are working within a hierarchical nature. There is a hierarchy in healthcare, but in order for us to work collaboratively, that notion of distributed leadership is so important. And I know Dr. Monod will be speaking a bit about this as well. The outcome of how we work collaboratively together, how we see ourselves in being a part of that role of leadership within collaborative leadership, gets us to those two outcomes. One is well-being of for our patients, for ourselves as providers, but it also allows for the notion that we're aware of. Is everybody in the space that we're working with feeling the same way? And that's an equity of feeling well-being in itself. And I think these kind of four circles help us to think about what are we bringing and what are we looking for when we're coming in to work in teams. Next slide. We know that as you come into the notion of working in teams, that in fact, from a competency-based approach, we do have competencies that people can learn how to be good team players. And this is from the Canadian Interprofessional Health Collaborative. And in these domains of what does it mean for us to learn how to be good team players, then we talk about having opportunities to learn about the roles of other healthcare professionals. And that's not coming into an orientation session and getting somebody to just spiel out, who they are and what they do. That is ongoing on a day-to-day basis, understanding and reflecting and being curious about the roles of other healthcare professionals and how they can be optimized in the care that is provided, or how their role, if it's misclarified, that could actually be improved and then utilized even better. That we know that there is time and work to be able to look at how do we manage disagreements, and you can do that within teams, within simulations. We can learn how to do that, and we can do that within many of our continuing professional development sessions that we have. We can consider some of embedding these competencies within there. Team functioning is another one, and I get to this notion of the collaborative leadership again, thinking that in teams that we need to be considering about shared decision making, and how is that being put forward forward. Teamwork, team-based care happens in various different contexts, and being aware again of the fluidity of who's going to be in and out of those teams are important, and being kind in terms of knowing that you may not know somebody who is entering into the team, but there are personal behaviors that we could have as part of professionalism that bring us to the broader spirit of team-based care. Next slide.
Ivy, just as we do that, I'm wondering, I really like this model that's here. Most of us in the physician space, but also in other health professions, even all across the world, we'll talk about the CanMEDS frameworks and leadership in there. So not to interrupt your flow, but I just had in my mind a thought of how do you think this type of work is translating to how we think of leadership in CanMEDS,
Yeah.
especially as that's being innovated nowadays?
I think what I'm really enthused about is the new CanMEDS leader role that's coming through, that will be launched next year, because I think many of these concepts are actually being embedded within that, and thinking
Mm-hmm.
about broader notions of communication and collaboration, and the notion of the hierarchical nature, and how we as physicians actually need to behave. Our behaviors actually can influence how teams are working in itself. And so the language that's being used in this CIHC competency domains is actually being utilized within the new CanMEDS framework, which
Mm-hmm.
means that I think that, again, both the nature of the importance of the domains of competencies, as we talked about it in the past, as it relates to the behaviors in which you would be looking at whether or not those competencies are in fact imparted in how people are acting. We can now use these kind of frameworks to help us, and it's teachable, and it's accessible. And I think that that's what we need to be able to do, because it does end up with patient safety, well-being, the equity, all the quintuple aim elements of it. That's what we're hoping for. It's team-based care for what? And team behaviors for what? There is a specific outcome that we're looking for.
Thanks, Ivy. I'm excited to see that come forward, and I think that'll be a nice way to put this idea into how we can optimize our teams to support well-being of others. So I'll let you continue.
Thanks, Victor. I think the other thing that is coming forward, and it fits really nicely with the work you're doing as well, and it relates to the equity aspect of it. And it is, we need to name where what healthcare, and name the elephant in the room, which is there is power and hierarchy in healthcare. And if you look at the power wheel, not only does that happen as you move to the center, but you think about those that are physicians, the power that that holds. We think about the members of the team that are there, and we think about whether or not they feel safe to speak up, whether or not that is based because of race, that's because of gender, and all of these pieces of thinking about and helping and teach our learners and ourselves about the reflection of privilege and power, I think is really critically important. And I first started this area of interprofessional education. I learned from one of my residents who actually was involved in an interprofessional education session with other health professional learners in primary care. They met once a week for about 2 hours every Friday afternoon, and debriefed cases and created management plans. And when we debriefed with the physician resident, at the end of the session, at the end of the learning course, we said, "Well, what did you learn?" One of the first things she said was that I learned that as a physician, if I spoke first, nobody else would speak after me in any of those teaching sessions. And so the awareness of, not that we even want to do that when we're actually in this room, but the awareness of power and privilege and how that may impact voice and team and collaboration, I think is the other area that we can actually be more aware of. And if people feel equitable and if they feel well, you know that you're doing the right thing within the team itself. And to me, that's the goal and the vision for team-based care, which will then ultimately impact not only our own provider satisfaction, but also our patients at the end of the day. So I think that that's it for me, Victor, and I'm hoping that looking forward for some of the conversation and some of the questions that people might have as well to delve deeper into these kind of concepts as we move on to your to Dr. Monod.
Mhm. Yeah, and maybe as we do that and move on to the kind of reflection piece, I think Ivy, you made me think a lot about that idea of different competency frameworks and how it might help some of our leadership behaviors, and how that can help us. I don't know like, what the best word is, but often activate the potential of the teams. Because I think this is one area where as a newer career person myself, I've always thought like I love the idea of working in a team environment with other people. That's why I'm a hospitalist. I couldn't imagine not doing it, but I do often feel like sometimes are we able to, in our roles as physicians or other health professions, able to really learn and benefit from all the skill that everyone else has all the time? So I think you really made me think about that a lot, Ivy. So I really appreciated that, and some of these takeaways that you have. So, Dr. Monod, I wonder, building off of kind of that introduction, and so those important principles that Dr. Anderson has provided us, I wonder, Dr. Monod, some thoughts from you around your experiences in the roles of us as team leaders, team players, team members, and some of the impacts that some of our behaviors and dynamics and things might have on well-being.
Thank you so much, Victor. And I think Ivy really set us up well with some very important concepts that need to be considered for that more effective team environment, especially interprofessional team environment. And I think I'll just start with a couple of general comments before I address the slide here. First of all, at the end of the day, we need to remind ourselves that we are all, um, you know, doing what we do for the same reason. And I simplify it very much by saying, we are, humans helping humans harness health. I like that alliteration. But really, and sometimes when we are in the midst of a system that is so challenging and where we have so many pressures on us coming from all sides. And I'm going to speak particularly as physicians now. It's important that we just remind ourselves that. And again, whether it's patients in general or the patient that's in front of you, and that it is really important to remind ourselves that we need to take that a deep breath in before we try to go into a team and address the issue that needs to be addressed. Oh, sorry. There is a noise behind me. Hold.
It's a virtual webinar with virtual delivery when something happens. So that way, this is actually happening and we didn't just record and put AI around or stuff like that. Like, this is actually a live thing. So um,
Oh
there's
gosh, I
that.
know. It's
Thanks,
too funny.
Jenny.
That's the only thing anyone's going to remember about today. My iPad just decided to wake up. Anyways, so I was saying that, so we're all human. So there's the point there. We are all human.
That's what yeah.
Uh, and so to just, and to remind ourselves how physicians who are so often in leadership roles, how we show up to these is super important. And so, this brings me to some really important work that has been undertaken by Shanafelt and colleagues that really shows, and of course, this was done related to physician burnout and satisfaction. Uh, the very strong correlation between the leadership qualities and the perspectives that physicians have regarding their supervisors, physician supervisors, and the impact that that has on the well-being and satisfaction of every individual physician. So this is about teams of physicians, right, and the physician leader. But there's no doubt that this actually is relevant to any groups of healthcare providers. And so, this very significant correlation needs to be kept in mind in our day-to-day interactions. Next slide, please. And so this work was done actually in Ottawa by a group that was looking again at how leadership behavior can shape culture, and really, really clear from this survey that was undertaken with a large group of physicians here in Ottawa, that again, how the leader shows up makes a huge difference in the ability to manage burnout, and in the satisfaction that physicians felt in their work. And so the elements that were really highlighted here is the importance of setting a tone. And of course, we know that that is such an important part of the culture. Showing kindness, and kindness is not the same thing as being nice. There's actually quite a differentiation there. Kindness is, again, that humanity of appreciating circumstance, being there to actually support in whichever way is needed. It doesn't always mean saying yes, or changing your mind, etc. But it's about how you go about managing any type of interaction with other humans, and fairness. So again, and that can be expanded quite broadly as well. But that concept that everyone around that team is treated in a reasonable way and in a fair way really is important in shaping that culture as well. And I think we'll talk about on the next slide, but nobody's perfect, but as often as you can show up with these concepts in mind, and with this sort of paradigm in mind, is is the best circumstance. And so, when I was looking at the case that was presented at the beginning of this session, and thinking about that interprofessional team, and again, the other challenging thing in our healthcare environment is that you may be with one team one day, and there may be new team members the other day, and it's very rare to be in a circumstance where you have necessarily the same healthcare team for any long period of time. And so that's another challenge added to that sort of setting the tone and creating the culture. But that regardless of of who that team is, and who the members are, that you acknowledge the members, and also to show up acknowledging the current moment. And that can be, as Victor said, okay, it's Monday. I know that half of you were working over the weekend. We're the busiest we've ever been. Appreciate everyone's probably worked long hours, and not taking breaks, et cetera, et cetera. But just whatever that moment is, to acknowledge the reality that people are in. Just again showing that you understand that moment. I think whenever you are meeting with your team in a healthcare circumstance, whether it's a specific meeting around one patient, or whether it's team rounds, etc., that it's clear, okay, we're rounding on the patients on this floor. We're hoping to be able to complete this by X, but let's remember we have this new patient to see, or so we'll have to start here. Just to sort of set out the plan, confirm what you're trying to accomplish. Um, and then as you're doing your work, or as you're trying to solve the questions that need to be solved, to really try to listen to all members, to even to look at people, calling people, by their name, or in fact asking their name and trying to remember their name, is just so empowering. And that whether they are a learner, or whether they're a senior member of the team, to really make everyone feel welcome and included, and that they belong on the team, and that's a really, really important piece. That's part of how we respect people, and how we make them, want to do their best work. And as you're going through the work of providing the care, it's important to describe the challenges or the conflicts, or just how the complexity of what you're trying to accomplish, and how there may not be one best answer. And you may, often what I will talk about is, okay, so what's the least bad way of dealing with this, right? Right? And so, and you try to reach a consensus. You can't always do that. But again, it's, if you are that person who has to make a final decision, because you are, as often is the case for physicians, the most responsible at the end, really try to see if you can get to a consensus, and if not, to explain, your rationale for the decision that you make. And I think, again, in the ideal world, to let people, give feedback either at the end of that meeting, or rounding, or following up with people afterwards and say, we had a really difficult conversation, so for this case where nobody felt good coming out of that, you may have a situation like that where at the end nobody's feeling good, but to be able to seek the feedback, and ask for advice or suggestions on how to do things better. And I think that, again, everyone would appreciate that. I think I can go to the next. I think I'll go back to you, I think, now.
Yeah. Well, Jenny, thanks for all those reflections. I makes me think of a few questions, or things, so if you'll temper me. I wonder, you start to list some of these leadership behaviors here. Can you reinforce like some specific leadership behaviors that might help foster that supportive team culture that you're talking about here, and this idea of the interprofessional environment?
Yeah, thank you. And I think that, as Ivy really illustrated so well by that real life example of what a learner talked about. And again, being able to bring in interprofessional education, of course, is super important moving forward. If you really can show up just in a very genuine manner, and allow your humility to come out, to really show up with humility, to be whatever word you want to use, vulnerable or authentic, but just be yourself and just say, hey, here, again, I'm here. We're all here for the same reason. Let's see if we can, try to make things better, try to make the least bad decision for this patient, or whatever the circumstance. And I think that, certainly historically, physicians have often been the leaders in these care teams. And yes, maybe at the end they are the most responsible, but so much of care is undertaken, and there's so many important parts of care that relate to our nursing, our OTPT, social work colleagues. If you can enable them to actually lead the conversation, or to lead, because often the issues are not actually medical per se, and so that might be a good opportunity.
Yeah, thanks. And I was thinking this a little bit when Ivy, you were speaking too, but Jenny, you kind of reinforced that idea of, we have hierarchical environments, right? Again, like Ivy, you alluded to, that there is hierarchy and there's reason for, and we can debate to the extent and whatnot. But Jenny, I wonder, how do you see that? You alluded to it a little bit just in what you were saying, but that, how is the interprofessional team going to function within this hierarchy environment? So you talked about already the difference of MRP and otherwise. Any other suggestions or thoughts for us to think of?
Think it really is all about you can name it, you can say okay, but say I really need your help, everyone. Like this is really complicated, and you are the expert in physical. You tell me when this patient once you've assessed this patient, are they going to be able to manage in their environment? I'm not the expert here on that, right? You are the expert here, right? So I think just really acknowledging the expertise of all the team members, or the student who's there, and say, you spent hours with Mr. So and
Yeah.
so. What is your sense of him,
Mm,
right? And what are his concerns and his fears, right? Or etc. Right? So like everyone on the team can contribute, and I think it's to make that effort, so that at the end, all the voices are included, and to really enact the fact that this is collaborative decision making. And I think that that is appreciated by all, as we all would, right? And we're included, and that our talents and our knowledge are acknowledged, is really important.
thanks. And then maybe I'll put this to Jenny if you start, and then Ivy bring you in after to this one. Like we're talking a lot about leadership here, despite talking about teams, and it is your data, our pieces have demonstrated why the importance of focusing on the leader in optimizing team environments is so important. But how can organizations better support leaders to focus on team well-being? How do we really try to make advances in that? So Jenny, if you'll start, and then Ivy, if you don't mind, maybe just to get some more perspectives on this, because I think this is a big takeaway that I'm getting as I listen.
Yeah, thank you, Victor. And today we're talking a lot about how can individuals help individual physicians as part of teams, etc. But as we know, such a huge part of wellness actually is the responsibility of the system. I think as leaders, we need to understand that we are part of that system. We need to engage with that system to make that system better. That's my sort of definition of leadership. And so, organizations do need to really highlight that everyone within that organization is important in actually helping patients receive the best care. And so, different hospitals have done this in different ways, but whether you are working in a clinic environment, etc., really to let all team members understand, and all employees understand that they are actually a part of what helps the care take place. And I think that the other responsibility is to set teams up for success. So again,
Mm.
try to maintain some continuity when that can exist. Try to make scheduling and shifts as reasonable as possible, and get input from all the people involved. Of course, training leaders and enabling leadership training is really, really important. And really appreciating those who are contributing to a better culture. I'll pass it over to Ivy.
Yeah, thanks. I think again, it gets back to the environment and the culture that you set up, right? So, it's so important that well-being is an outcome, and that outcome is based upon what you are situated within. I think one of the best questions as to whether or not you've got an environment that will value who you are, particularly within a team, is ask your team. And it's quite interesting if you ask different members of the team, and I will say within the hierarchy as well. There's studies that will show that, if you ask physicians, oh yeah, no, we're a great team, we're a safe team, we're a fantastic, everybody has a voice. But if you ask the other members of the team, they would say no. And what's curious is about understanding, well, why is there a difference in perspective in that? What happened there? And I look at some successful teams, and there's a few things that come forward. One, there are basic principles. They talk about, how do we want to work together here? How do we want to hold each other accountable? The infrastructure is put into place. So there's time set aside. There's time for people to get to know each other. There's some parties and etc. That seems like it's such a silly thing, however, but it makes a big difference. Learning people's names. So it's not, oh, you the nurse or you the physiotherapist, you tell me. If there are signs within the culture as to whether or not you've got an environment that is welcoming of the people that you're working with. And that comes from, again, who leads that? And I think that's the distributed leadership component of it, that it's everybody's responsibility to do that. And as you said, Jenny, when you've got so many new members coming in, like you can't have an orientation every single day. It's the behaviors that we demonstrate every single day, and that kindness and that humility and the being able to listen. Somebody new coming into an environment, if they see other people working in that way, something's happened in that environment. And no doubt that in that kind of environment, you will feel the well-being. You will feel good working in that space. And if you feel good working in that space, you will do better for your patients at that point in time. So I would wonder, like, how often do we ask the question on psychological health and safety?
Mm.
How do we ask, like, do you feel well within your team? And how much do we take importance in the answer that comes forward? And what if we did? And what would the interventions be? And what are the repercussions if we don't ask the question and that continues to happen? What happens to ourselves and what happens to our patient care? So I think they're all connected. Our own self-reflection, our emotional intelligence, our ability to actually be kind and create the infrastructures, and then the knowledge base of there are competencies to actually make us work in this better way that reflects shared and collaborative leadership. And we can teach those things, but they have to be reinforced in the environment in which we're working. And that often comes back to leadership and the shared leadership roles.
Thanks, Ivy. As Jenny, I let you summarize a little bit of what we just talked about. Next is the question period. So everyone, like I said, if you don't want to listen to me continually ask questions, please, through the Q&A function, which you can find, or if you feel comfortable, you want to raise your hand, and then we'll let you unmute your mics and ask questions. But the next is where we'd really like to invite you into the conversation for the next 10 minutes or so. So Jenny, I'll let you summarize, and then hopefully people are ready with some questions and things in the interim.
Thank you, Victor. Yeah, so as much as you can show up as a very humble and genuine leader who really cares for all members of the team and helps them create a sense of belonging within the team, and that really squashes down the hierarchy if everyone feels that they are engaged in the decision making in a collaborative way. And again, organizations, that could be a whole other topic for another day. So I think we'll go to the conversation now. Thanks.
Great, awesome. So thanks. There's a participant who shared in the chat, Canadian Health Workforce Network Bilingual Health Worker Burnout Toolkit. So again, from different levels of intervention and audiences. So that's great. We'll share some CAMI resources as well. Thanks, Ivy, for Joy in Practice study. Lots of ongoing pieces and things there around different resources that we can use. So I will refrain from asking another question just to try to let someone jump in either the Q&A or the chat. So I'm just checking them to make sure I'm not missing any.
Yeah, Victor, I think the topic of leadership is really, and it's going to continue to
Mm-hmm.
emerge and the influence and impact of leadership. So I really liked what you said, Jenny, and I would move that these are leadership skills that across all health professions, and that notion of what is distributed leadership in a hierarchical nature of healthcare and how do we function when there may be different leaders at different times, and how can we also be followers? So that notion of leadership and followership, where does that fit in, and how does that influence one's feeling of wellness, that you can lead and you can follow at the same time.
Mm.
What does that do to the members of your team when you can have that fluidity? And what does it take to actually make that happen?
I've wondered too a lot about accountability in this idea, right? Because against many of these points, generally we've gotten to a point in the conversation, thankfully, where we're not arguing about should we care about well-being or should we think about it, right? Usually, people aren't saying, "Oh no, that doesn't matter," which is still a feat considering how many years ago that maybe was still up for debate, unfortunately. But accountability is hard, right? Because we see the studies and the metrics that show that leadership behaviors have this impact. But just like everything else, the health system and others are really just trying to scrap through because, that's just the reality of the current times. So, I mean, I don't expect Dr. Anderson or Dr. Mano to necessarily have an answer to this, but I've wondered lots about, I just wonder your reflections on ways to help around accountability for teams. And again, not even just for a leader, but for a team to foster these behaviors or these ideals and how to help reinforce some of the accountability around that.
Well, I would suggest that at the end of the day, it really is the organization that ultimately is responsible for the overall care that is provided to the patients. And so, really, it is up to them to ensure that they are undertaking, all that we know must be done to create this culture that is that we know is so essential to the well-being of all, which then leads to best patient care. And we all know of organizations where actually this works really well, and
Mm.
others where it doesn't, and perhaps where people don't actually walk the talk, right? I think a lot of organizations now are doing the talk because they need to, and it's kind of, oh, it's accreditation standards for hospitals, et cetera, et cetera. But when you get to the very grassroots, that's not what's being supported. That's not what's being recognized. That's not that isn't really where the priorities are. When you actually understand what's happening on a day to day, and uh, the lived experience of people in the organization. It's about every single interaction, right? It's about how the leader shows up. It's about what is appreciated, what is recognized, what is supported, what leads to advancement in an organization. And so, it is complex for that organization, but at the end of the day, I do think that they are responsible. That being said, right, as healthcare professionals, um, you're the one who decides how to show up. And despite all your frustrations that you may have with that system, number one, you know, be part of the solution as you can and engage in the system to try to set that improvement. But also, you must be that role. You need to do what you can to try to role model those best behaviors that we just talked about.
Yeah, I like that, Jenny, and I might I take a different angle with it and think about it from the notion of shared accountability. amongst the perspective of the team in itself. And I think part of that, I just did a session with CMPA, the Canadian Medical Protective Association, and there's a lot of misunderstandings of liability and risk. And we, as physicians, often will feel that we are ultimately at risk for certain things. And yet, it gets us back to understanding the scope and the role of the other healthcare professionals and what's within their own scope of practice, and whether or not if they make a mistake, then they themselves, or if we make our mistake, then, we're accountable. But there's the opportunity to think about, I've got your back. And, I'm not going to blame you if something actually really happens that's bad. I mean, in terms of the patient care components of it, we're all in it together. And I just don't know if that's the spirit of what we develop within sort of the workplace. Again, it's the environment and how we're working. If it feels like, and we know this when we have and talked about it even outside of the healthcare, when we know we've got a skill set and a knowledge base and it's not being utilized or heard, that really is crappy. You don't feel well, you don't feel valued, you don't feel heard, you don't feel like you're contributing. So back again to if I'm part of the team, am I also willing to be part of the accountability of that particular patient? And that means that that's not left to the physician, for example. That is, everybody is collectively responsible. And just like that Toyota example, it is anybody's responsibility to pull the cord if something else is coming about. But I don't know if we pay attention to that as much. So I would be pushing for, what does shared accountability mean in a healthcare environment where the organization has lots of policies and rules and responsibilities that may or may not actually support teamwork at the end of the day, and points to who's the one who has to be blamed at the end of the day as well.
Thanks so much, Ivy and Jenny. All right, so our time is nearing an end. And thanks, the participant shared some notes in the chat as well. I see some things about Institute of Healthcare Improvement, papers and others for us to all peruse through. So I think wanted to end really with the thanks to Dr. Anderson and Dr. Monod on this conversation. And I hope that this helps spark to all of you, that thought and ideas around, how do we think about team care in a way that allows us to think about well-being and optimize it, and what are our roles in all this when we think about the future of what team-based care is, and impact on well-being. I loved at the ending around pieces of shared accountability and things like that as well. So I hope everyone was able to learn something from our conversation today. I certainly did. Recording will be available for you in summary after. There's an evaluation form for everyone to fill out. And then this is part one of a long series, hopefully for many years to come. But our second session is December 3rd. And it's going to be in partnership with the Canadian Association of Physicians with Disabilities, talking about inclusive design of our healthcare systems and health professions education, and how we think about accessibility, learners and physicians with disabilities, and that work. So registration for that will be open soon. You can subscribe for updates or different things as well. So thanks again, everyone, for participating. And thanks especially to Dr. Monod and Dr. Anderson for your expert insight.
Thank you so much.